Welcome to Courtney on Health. And now she takes the time to adjust her.
No, it's okay.
No, go ahead.
Courtney on Health. Yes, here we are. Courtney on Health
on MalcolmPresents.com. A Zoom cast into the portals of a new world.
Yep. Is it a brave new world? That's my question.
We're streamed live, but we're not on live. But all our shows are on demand and are archived. All you have to go is to YouTube or MalcolmPresents.com and click on to Courtney on Health. Anyway, guys, give us a lead-in.
And also Courtney on Health. You can catch her on a podcast. So, hi, Courtney, and hi, Malcolm. Welcome to Courtney on Health. Hello. A Zoomcast podcast series which focuses on one's overall well-being with tips on nutrition and exercise and all good stuff, given by Courtney Gravenese, who is a registered dietitian, and she has a Master's of Science degree in nutrition and applied physiology. She's got a lot of letters after her name. Courtney is an experienced nutritional and health consultant in the New York metro area and into the beyond universe, and will help guide you on a path to wellness and health. We want to be well, we want to be healthy. So the phrase "watch your back" metaphorically means to see like what is going on behind you, who might be saying something, who might be doing something. But it's important to take the literal meaning seriously as well, because you want to keep your actual back healthy and free of pain. Up to 80% of Americans will experience low back pain at some point in their life. That's a lot. So why is it so common, and is there anything that can be done about it? The spine supports all of your upper body weight. It puts a lot of load on the lumbar spine and results in mechanical stress and strain at times if you work out or lift too much, or if you sit all day at the workplace or behind your computer, or sleep in a weird position even, it can affect your back. So what can we do to prevent back pain? Courtney has like some great info that will help you watch your back, literally, to make sure it stays healthy. So why is the back so, pain so common, and what, can be done? I know you'll be giving us information on a preventative level to reduce that.
So hello to both of you. So yeah, that's a big number you mentioned, Maxine. That's a lot of people suffering, and that's not good. So there are multiple factors that probably contribute to that much back pain. It could be our everyday lifestyle. It could be how inactive we are. There are some individuals who were born with certain congenital back disorders, and they have to live with them lifelong. Is it our diet? Is it inflammation? So it's probably a lot of different things, but we're going to really sort of focus in on what's been tried and true and what's been recommended for not only preventing back pain, but for those individuals who have the diagnosis. So this is assuming, of course, you've seen a medical provider, an orthopedic specialist, and you've been diagnosed with, and I'll let everybody individually sort of fill in what that is. 9 times out of 10, lying in your bed and doing nothing is not going to be part of the protocol. So, and I say that because not so long ago, and maybe even 20 years ago, if you, threw out your back, or did some kind of back strain, that is exactly what the advice was to, get in bed and, you just rest. No, that's not, we know differently now, and can, make those recommendations. So make sure you've had a good medical diagnosis, a good evaluation. Certainly if you have been suffering with back pain for, longer than a usual amount of time.
Right.
So people, you mentioned it, Maxine, some people have jobs that put them at greater risk. So people who lift a whole lot, construction workers, things, professions like that, would certainly put them at risk. I now put individuals who sit behind a desk at that same risk level. We are not designed as human beings to sit on our bums for, 6, 7, 8, 9, 10 hours a day. It's just too much. And at the end, I'm going to make sure I talk about ways to sort of work around that. You couple sitting all day with poor posture while you're sitting, and that creates an environment that can really worsen an already bad situation when it comes to,
you tend to get hunched over. I mean, I
Yes.
try to stay straight, but I know I try to keep my computer at a good, in proximity,
Yes.
but it doesn't always work. Luckily I'm not in an actual office with people looking at me, so I can get up and move around a little. I can, again, put that Latin music on, or Latin, whatever it is, and move. And I know I need to move. I know that by listening to you for all these shows and the great information you're giving is like, Max, you got to move. So yeah. So what do we need to do? Do you need core strength or healthy weight or posture? You're talking about posture. What, like ergonomics of things? What do we need to make?
Why don't we start with the ergonomics of working, since you mentioned it, of working at your desk. I believe we've discussed this before. I will actually post a photo of the dimensions and the alignment of how you should be sitting. So if you're sitting at your desk, and just bookmark standing for a second, you're sitting at your desk. Generally, you want your nose to be straight out. You don't want to be looking up at a screen, nor do you want to be looking down at a screen. So the importance of a movable screen is going to be key, because you want it at eye level. You also want that screen to be roughly, and you don't need to bust out a measuring tape, roughly 18 inches away from your eyes. Can be a little bit closer, can be a little bit further away, but the point being, you don't want to be this. Okay, so that is important. I always want you to think about 90-degree angles, and I feel like I say this all of the time, but it's so important to mention 90 degrees at your knee, and 90 degrees at your elbow. So you want to make sure that you're sitting at, I should have worn a different color. See my background in my light pink, I'm blending in over here, but hopefully you can see.
We 90 can see.
Degrees from your forearm to your upper arm. You don't want to be up like this. You don't want your keyboard down like this, because what that ends up doing is creating a position for your back that's not natural.
Right.
Everybody can't afford a Herman Miller super whiz bang fancy, office chair. I wish we all could, but we can't. So you got to work with what you have at home. Our last episode, we spoke about perhaps using a stability ball. As long as your alignment is correct, and you're not slouching, that is certainly a relatively inexpensive option for part of the day. You can also work with whatever chair you have by creating a little bit more lumbar support. And I'm just going to go through back anatomy in 1 second, a little bit more lumbar support with whatever chair you have to work with. So let's talk about that spine for a second. Quick back, anatomy 101. You've got 5 regions of the spine. Starting at the top, you have cervical spine. So if you've ever had any kind of x-ray or you have had issues with back pain, oftentimes they're able to specify it. They might say L1, they might say T number, and that letter is corresponding to that region of your spine. So cervical spine is the top, followed by thoracic, then lumbar, which is that curved section. I just mentioned lumbar spine, where you might want to put a cushion, your sacrum, and then way at the end is the coccyx. So that is the anatomy of your spine, and its role is to protect your spinal cord. So you've got the bones, and then you have these fluid-filled discs that sit in between each of the bones of the spine that, hopefully, if they're healthy, they're filled and they're not leaking. But over time and with age, sometimes they get a little compressed, and some people have some issues, over time. So very important role. If you think about what your spine does on a daily basis and what it is able to do, lean forward, lean backwards, it's able to twist side to side. It's pretty remarkable.
Right. We stand up all the time. You know, where humans stand by nature, while most animals, the majority,
Yeah.
are on all fours.
Right.
So the weight distribution is different. So your whole body, you know, and also the feet actually take up a lot, you know, get a lot of
Absolutely.
abuse too. And so yeah, but the back seems to be, you know, the issue there. I mean, I know it very well. Because
yeah. I was diagnosed with spinal stenosis, which, but there's so many things. I think I was telling Max, I don't know about you. I lost about 1.5 inches as far as, you know, as I'm getting older.
So that's the narrowing for those of you who are listening who don't know, not familiar with spinal stenosis. So that is a narrowing of the backbone in certain areas, which can create pain. So it doesn't always, I mean, in many cases, well, in some cases it requires surgery. This is obviously a conversation with, you know, with your surgeon that you need to have and your medical doctor. But yeah, that is one of the back issues that an individual could have. But even in the absence of a diagnosis of spinal stenosis or arthritis, simply carrying too much weight. And it's just the reality of things. This is not an indictment of, you know, being overweight or obese, but the reality is the more weight you are carrying, the greater the stress on your spine. So it makes it harder and harder for it to do what it needs to do. In fact, I've heard the phrase, the problem with your back is your front, particularly for some people who have they carry their weight in that apple mode. We've talked about this before. So they carry it as an apple. So they're carrying a tremendous amount of belly fat, which of course is going to do what? It's going to pull you forward. So it's going to make it harder and harder for you to correct your posture and make it more painful because of that excess weight that you have on board. So, you know, managing your weight is certainly, from a preventative measure, one of the best things that you can do to start. Smoking.
Is that the same thing with, I'm sorry, with, because you're speaking to that, like sciatica seems to be like everyone I know, like I had a, you know, bout of sciatica. I'm like pain and you know, sometimes you said like laying down was, you know, the thing to do. Now, no. Now, you know, they want you moving around, but what's the difference with, you know, I mean, what is sciatica? Can you just quickly explain that?
Yes, so typically people with sciatic pain, and again, you guys know, I always have to put this disclaimer out. I'm not a medical doctor. I know my lane as an exercise physiologist, but typically people who have sciatica are going to have a firing pain that sort of stems down the gluteal area and then down the leg. As opposed to like people with sciatic pain aren't going to have pain in the cervical spine area or the thoracic spine area. So it's a very, very localized area. And in terms of what could trip it, it could be a variety of things. It could very well be excess weight that's being carried, but it also could be an event that triggered it or tripped it. So it could be you lifted something in a very peculiar way. I mean, when I'm working with clients a lot and when I read a lot, sometimes a back injury is triggered by what seems to be such a small thing. Like you literally were reaching for something, but you happen to be at a really peculiar angle, and that could be it. So sometimes it's not necessarily you being a weekend warrior. It's something that you typically do all the time, like maybe lifting a baby out of a car seat, and it's just catching you at the wrong moment and weakness. And that's, you know, could be one of the reasons. So there are a variety of back issues, which is why, again, it's important to, if you've been suffering for a long time, to get a proper diagnosis. Know what you're working with, and then you can appropriately set your plan along with your healthcare provider for the types of exercises and the things you can do for that particular diagnosis.
Just a personal story there. There's so many things that could trigger back pain. I've had back pains now probably for a good 30 years. And originally how it started, or maybe even more, I was taking a shower and I sneezed. And when I sneezed, I'd bend over. and an electric shock went through my bottom of my back, and it was locked in position. I
That
could,
sounds like fun, Malcolm.
yeah,
Yeah.
I could not lift
Yeah.
my body.
Yeah.
I had
Wow.
to go to bed and fall down. And the doctor said, like you said, the only thing was rest. You couldn't do anything.
Yeah.
Right. Well, there's,
But
I
not with,
mean,
but back to, Maxine, to your point, people with that sciatic nerve pain, you need to be moving, you need lubrication, you need there to be the muscles around, obviously the sciatic nerve, that's not necessarily a bone issue, but you need to strengthen in many cases the muscles that flank that spine. And that's where we might be falling a little bit short, not necessarily you, Malcolm, with your issue, but in general, where Americans may be falling a little bit short is in terms of inactivity, and then coupled with either the complete absence of muscle strengthening or inappropriate muscle strengthening.
so core strength and exercise, are those something that could be thought of as preventative even,
Oh, absolutely.
So-
Absolutely. And I think most people on a daily basis should be doing, core strength. And remember, just a refresher, I know it's one of our past episodes, but your core is more than just your abdominal area. Your core is the muscles in your thoracic and around your thoracic spine and your lumbar spine. It's your whole gluteal group. So the muscles in your hips, I want you to think about that. So it's much more than just your abs. So what you can do, and I actually have a great resource for people that I have been using for quite some time that's very helpful, is a variety of different exercises to strengthen your core, strengthen your gluteal group, strengthen the muscles in your around your spine. So it's really important to couple that with some type of cardiovascular exercise, with walking being certainly one of the simplest options to do to keep that blood flowing, keep yourself moving, and that combination will be the best way to support you as you prevent and back issues.
So
Yeah,
staying in motion, that's a key thing in general, probably, to stay in motion when you can. And does standing help? I mean, if you're sitting at your desk,
Yeah.
they have these standing desks now
Yep.
to try to get people to get up. I mean, what is like being done in terms of that?
Yeah, so standing desks are wonderful. They are so the pros are they're fantastic because they get you up off your bum. You can adjust it. It's on a bit of this little hydraulic system. We have one upstairs. You can move it up and down so that you don't have to be standing all day long. You can actually sit and stand throughout the day, which is great. Problem is they can be a little pricey. So that might knock it out as a potential option for a lot of individuals. So, but as an alternative, and I'm going to report on it when I get mine, because I've noticed I'm working more in a different space that's not near my standing desk. They have laptop stands that operate under the same function. So the laptop sits in this little hydraulic stand, or even not hydraulics, it's just on a spring, and you adjust it. So for example, if I'm standing right now, I don't know if you guys can see that, my screen is too low for me to be functioning it. If I'm working, I need to lift that screen up. So it would allow that opportunity. So that's the plus. It works the same way. And the big plus in my mind is that you can get it for $50 or less. Read the reviews online. And it's a great, great option if the standing desk is not within the budget.
I saw that last week. It came up on something, and I saw this standing, the stand that goes up and down. And I'm like, that's interesting because I have a laptop, so
Yep.
that would be perfect.
Just a bit of warning about walking. I mean, because I was running, and a lot of problems, even when people walk, is how they land on their feet, because every foot is different. And every people who walk in a certain way that might put extra strain on different parts of their body.
Right.
So it's simple walking, but you have to have the proper shoes. You have to have the proper insoles. And when I was running, I got the orthotics, which custom made orthotics, which are expensive, but they have a lot of orthotics now that are less expensive, but
Right.
you still have to be careful.
Right. So I think more than likely it's people's posture in general, which is woefully out of alignment. So people slouch. People are standing perpetually in a pelvic tilt. Or they've got sort of that cow back. So what I mean is their tailbone is sticking out, and they've created a more pronounced lumbar spine arch, which is not the way you should be standing in a neutral position. So many times it's whether you're standing or you're walking, it's because you're either slouching or you're sort of overcompensating. And then that in and of itself can throw off your gait, which can contribute to back pain as well. Certainly a decent pair of sneakers is going to help, but posture when you're sitting, posture when you're standing properly is going to be key. For those of you who are standing on your feet already all day, and so this may be a lot of professions. So the good news is you're standing on your feet all day, which is a good thing. You burn more calories when you're standing. It's better for your spine. Problem is that can, put a strain on your back, which is not what you want. Simply by lifting one foot up, not very high, think a small step stool height is going to be particularly helpful. And then of course you're going to switch feet. So right foot up, and then at some point later, you're going to bring your left foot up. What that does is it allows a little bit of relief in the muscle supporting your lower back. So there's an option for those of you who may be standing all day long as opposed to sitting all day long.
Yeah, my PT said to me once, do the marching it's like a marching, and I do it every day after that. But does yoga help, or does stretching help? And then I just wanted you to touch on smoking and inflammation, if whenever you want to do that.
Yoga, absolutely. But I just want to give a word. I would say for newbies and people beginning, and you're just starting out on what can I do to keep my back strong and flexible, start with stretching. And while we're there, I'll talk about it. So if you all go on to, and it's a very credible website, I'm sure there are others, but the American Academy of Orthopedic Surgeons website has a great handout for spine conditioning, which I highly recommend. There are pictures, it's easy to follow. You can sort of customize it a little bit. It's a great tool for you to use that will keep you on a schedule for strengthening your spine. So I highly recommend that. American College of Sports Medicine has a great one as well. So that's with regard to stretching, and I think everybody should be doing that. Yoga absolutely has been recommended, tried and true, but I think for some people, yoga might actually be a little advanced for them. So I would say start with a beginner level yoga class. Make sure your instructor knows that you are brand new to yoga, and he or she will help guide you to modify positions so that you are not injuring yourself in the process of trying to keep your back strong. But absolutely, yoga as part of the whole plan for overall wellness and back strength, back strengthening, conditioning would be absolutely recommended.
Yeah, as you said before, I remember, a number of years ago, the key word of strengthening your back was strengthen your core. That was every time I went to any sort of exercise class or did exercises, the instructor strengthen the core, and that will, prevent the back pain.
So
right, absolutely. But the problem is most people don't know what the core was, which I'm saying it's important that you understand what those are and which muscle groups we're talking about, and to have somebody who knows what they're doing. Or, like I said, I think this guide that I mentioned is it's very clear, and the illustrations are wonderful in terms of, how to guide you through the process. So smoking, you asked about, Maxine.
What's the connection with that to the back? I mean,
I know it doesn't. It seems odd, right?
It seems odd to me. Yeah,
to do with it?
Right. What's your back? Yeah.
If you keep in mind that we know that smoking damages your arteries, and of course, it can affect blood flow. When smokers typically have thicker, gunkier blood. As gross as that sounds, it's what happens with years of smoking. And that means that you don't get as great of blood flow to, your discs and to joints, and that overall can cause back pain. So for one more reason why, if you are a smoker, to get the support you need, the resources available to you, to try and quit smoking. I realize it's not easy, but to try and quit smoking and make that part of your working plan to try and protect your back, protect your spine.
Wow. So that, yeah, I never got the connection up, but that makes a lot of sense. In terms of things that cause inflammation has an effect on it. What do you say about that?
Yeah. So, I feel like inflammation is like the word of, the decade, right? And I want to make sure it doesn't get so thrown around that people are like, inflammation, whatever, so.
Right.
So we're not talking specifically about arthritis, but some folks know that arthritis, excuse me, is an issue of inflammation of the joints, not just in your spine, but trying a diet that reduces some of the inflammatory foods that you may be eating can only help. We know that it may help with a variety of other different issues like cardiovascular disease. So if we're tamping down the inflammation in the body, there's a good chance that it may reduce some of the inflammation, which may help with some of the pain you may be experiencing in your back at any point across along the region of your back. Your spine.
Yeah, that's something that inflammation is the word. It's just you think about what you can do to tone down the inflammation, and so many things that could affect it. One thing though, in terms of backs and I remember when my son was in middle school, there was a big parent outrage about their backpacks and how many books they had. I mean, now I guess you have an iPad or something, but back then, my kid was like, the bag weighed more than the kid.
You would think. I'm with you. You would think, I'm like, you've got an iPad, you've got not an iPad, you've got a laptop that you're bringing back and forth. How is your backpack so heavy? Except that they need to bring everything with them now, at least in our district. But I hear this a lot. They have everything coming with them because on the off chance that they need to lock everything down, they need everything at home with these kids. So my son, he walks up the hill, much to his dismay, by the way. I'm going to make sure he listens to this episode. He's like, why do I have to walk up the hill to the bus? So, but he's got this heavy backpack on, and I remind him, like, watch your back, tighten. He's horrified. I'm like, tighten the muscles in your butt. He's like, what? Mom, stop. Just stop, Mom.
He's a boy. That's what they do. Like, leave me alone. It's like,
leave my butt alone, Mom.
Stop nagging me. But I remember them like and that was, in the early 2000s, it was like these kids, it was crazy. And it could cause, issues with their back at that age.
Surely.
So it just, it came to my brain like backpacks was like a big thing.
Well, another big thing, which it doesn't affect me, but affects women, is women who are well endowed. A lot of them have breast reductions because the weight, it's constantly bearing on their back.
Yeah, like I said, the problem with your back could be your front, whatever. So, but
or pregnant, if you're pregnant. Pregnancy, you can get back hurts. So, yeah.
Well, I don't know anyone over the age of 50 that does not have back problems. I think 85% is a low number.
Well, you think about it, you've been doing a lot of there's a lot of wear and tear that's just going to happen, right? It sounds horrible. It's like, oh my gosh, it's like, what happens, after you hit 40, everything starts falling apart. But the reality of it is, even if you are in absolute tip-top physical condition, unless you're, Tom Brady or a very seasoned athlete, most of us are going to have a little bit of, degenerative disease that's going to happen over time. And so what we do best is to minimize that pain and keep as strong as we possibly can, and don't keep up to pace with whatever activities that you're doing, particularly strengthening. And I feel like a lot of individuals, it's getting better, but once they hit 50, 60, 70, I feel like the weight training and the core strengthening tend to go by the wayside. They're great at maybe doing more walking and staying, cardiovascularly fit, but they're missing that piece of the puzzle that is really so key to keep the muscles around the spine very, very strong and flexible. So that really has to be, it's an important point to bring up. It has to be part of the plan, the fitness plan for overall back strength.
Yeah, right. I mean, I know the problem, let's say with me, there's so many things that contribute to, back being out of alignment, the way you walk, your gait, your arch on your foot, whether you stand straight or not. The big thing I know for a while was lifting, because people would bend over without bending their knees or legs and lift up, even if it was a light thing.
Sure.
Right.
And you're always supposed to bend your knees and squat and pick up with your legs.
Yeah.
But what about people who say they wake up, they're sleeping, and they wake
I'm
up?
so glad you brought that up, Maxine. Sleeping.
Okay.
Sleeping.
Well, so thank you. I would have my cue cards I need. So sleeping. Thank you for bringing that up. So
Okay.
take a look at how you sleep, because waking up in pain, it never feels great. You got to start your day. So think about the night before, right? How you can get yourself in better alignment. First of all, take a look at your mattress. And I'm not trying to get people to spend, I'm not being funded here by Sleepy's or any other mattress company.
Right.
But you got to check your mattress. And if the thing has a divot in it from where your bum's been for the last 40 years, it's time to get a new mattress, or at the very least, flip it. So take a look at your mattress integrity. Take a look at your pillow height. Okay, you don't want the pillow so fluffy that your chin is practically buried into your chest. That's not a natural alignment, nor do you want them to be so flat that you're not getting any kind of support at the top. So remember, we went to that cervical spine, section, cervical section of your spine. So you want somewhere in the middle. The pillows are going to be helpful if you place them under your knees. Now, again, this is not going to be for everybody, because some people are side sleepers, but even so, putting a pillow in between your knees helps get your hips in alignment, so that if you're a side sleeper, so that you're not falling back. And if you're sleeping on your back, which most of us hopefully are, you can put the pillow under your knees to create a much more natural position you could be sleeping in. And it does help. I'm speaking from personal experience here, but if you look at any of sort of the orthopedic surgeons' websites and recommendations from physical therapists, it is one of the recommendations for proper sleep hygiene in order to help with back pain.
Yeah,
Wow.
Courtney and Max, I hate to tell you this.
That's a mouthful, but yeah, that's important.
The
Sleeping.
time is up, and I think we might have to spend another few hours on the back.
Absolutely. I mean, if you start getting into sleep patterns, that's a whole other ball game.
Take us out.
All right. Well, this was great, Courtney. Really good information. I hope our listeners get into what you're saying and start, doing things to help their back. So with that, thanks for joining us for Courtney on Health. To get more info, follow Courtney on her Facebook page, which is Courtney on Health, on Instagram and TikTok at CLG Wellness, and visit her website, CourtneyGravities.com. For more shows, go to MalcolmPresents.com and theManyShadesOfGreen.com. So this has been Courtney on Health, smart, sound nutrition, strong, safe fitness, and we'll catch you again next time.
Again, bye. See you next week.
Bye. See you next time.